Many people who have previously sought mental health care and didn't get great results start to believe that either their case was too severe to heal or that the previous provider's care was bad. But the truth is, you can heal, and your continued struggles don't always mean that the care was bad. You see, mental health training is designed to get everyone up to an average level. To become better than average, a provider has to put in additional time and effort to gain additional knowledge on their own. Let's use a metaphor to illustrate this. This picture represents many people's psychological state who are struggling with serious mental health difficulties. Emotionally, their temperature is about 0 degrees Fahrenheit, whereas a healthy individual sits around 85 degrees. Now remember, 32 degrees Fahrenheit is when water freezes, and these people are at 0. So they're 32 degrees below the freezing point, and the frozen snow represents them not being able to live a happy and productive life. Even worse, life has been so rough for so long for these 0 degree individuals that the snow is built up and is a couple feet deep. If you look closely, you can see that the cold wind is blowing and the trees and landscape, they're covered in crusty snow. Moreover, everything in this emotional landscape is dormant and in hibernation for the winter. In fact, most people in this state can't even remember the last time they saw the blue sky or the sun. Bottom line, these people are tired, cold, and they wonder if there will ever be an end to the psychological winter they're living. When they seek mental health care, which provider they choose will make all the difference. If they choose a provider with minimal training and expertise, that provider will generally use correct first aid and will raise the patient's temperature some. However, a provider with minimal training and expertise can only raise the temperature 20 degrees. So while the first steps were correct care and did help the patient some, their temperature only rose from 0 to 20 degrees Fahrenheit. That's 12 degrees shy of melting some of that emotional snow. So while the patient's emotional temperature did rise up to 20 degrees, they didn't experience any of the improvements that come with melting the snow. These patients often experience this and incorrectly conclude that the care was not appropriate or that they are a hopeless case. This is why providers with minimal training should generally limit their patients to mild cases where the people are starting treatment already up to 60 or 65 degrees emotionally. I saw a wonderful example of this when I was in medical school. One of the students had a wife and a brand new baby. His wife was struggling because she not only was a new mother, but also had moved away from her family for the first time, almost never saw her husband because he was always studying. She was in a new town and she hadn't had time to make friends. This wonderful woman realized that she was going to struggle and sought care before she started feeling anxiety and depression. After 2 sessions with the provider, she received the mental health first aid that she needed. In that first aid, she learned that her stress was normal, that she'd actually done quite well with the changes happening all at once, and that with a little time, she would find a rhythm and that the stress would decrease. This is an example of someone who started therapy at 65 degrees and the first aid was all that was needed. She could have picked any provider, to include the minimally trained provider, and those 20 degrees would have been given with that basic mental health first aid. So a minimally trained provider would have been a fine choice in this example. But not for all examples. The next level of training is called average. Providers with average training have slightly more expertise. This increase in expertise allows an average provider to raise the temperature a little more than the minimally trained provider. They can raise the temperature about 30 to 35 degrees. So if they're treating a patient that's starting at 0 degrees, their care can result in enough of a temperature raise that some of that built up snow melts. As you can see in the picture, the tree branches are no longer covered in snow and the amount of snow on the ground is lessened, but that's about all the improvement that will happen when a patient starting at 0 gets an average provider. But their limitations on raising the emotional temperature doesn't invalidate that provider's work. It's still valuable, and their 30 to 35 degrees may help many people who are coming to treatment with a psychological temperature in the 50s, but I will admit that their care doesn't have much impact on someone starting at 0. Now, the providers that are a level above average have even more expertise and training and are called very good providers. A very good provider can consistently raise the emotional temperature 40 degrees, or for brief moments, 50 degrees is possible. So if they are treating a patient that's starting at 0 degrees, their care results in enough of a temperature raise that most of that built up snow melts and some of the grass becomes visible. In fact, The patient might even raise from 0 degrees and no sunny days to having a few days where they see the emotional blue sky and the sun. The very good provider can consistently help people whose starting temperature was as low as 35 to 40 degrees to reach the full 85-degree level. But long term, they'll struggle with someone who is starting in the 0-degree stage. Now, before we talk about the final category of providers, we must explain a general limitation on the minimal, average, and very good providers. Most of these providers will do 80 to 90% of what I do. They'll use antidepressants for depression. They'll give therapy to patients that are struggling. But as you learned in the 3 False Beliefs webinar, because they can't see the why that's causing the problem, they won't be able to customize a treatment for each individual. This means that they won't be able to find the best antidepressant for that person's exact life circumstance, or they won't know whether one therapy approach or another is the best for that person. These details have a major impact. The extra 10 to 20% that University Elite providers do allows us to raise a 0-degree patient all the way up to 85 degrees when others are limited to raise between 20 and 50 degrees. All too often, these non-University Elite providers' treatments are based on managing symptoms instead of treating the cause. Furthermore, because they aren't treating the cause of the symptoms, their patient's temperature usually only raises for as long as they remain in treatment. Once the treatment stops, the temperature, it plummets back down below freezing. This generally doesn't happen when a patient learns the why and gets a customized treatment plan. With that understanding, we can now define the final group of providers. As you've likely guessed, the last group of providers are those who have the highest levels of expertise and training. They understand the why. They educate their patients on what's causing the struggles, and they customize a treatment for that individual patient. These providers are called elite providers. They are generally experts who are also skilled teachers that can help the patient learn the why while also raising that temperature up to the 85-degree mark. Their patients generally maintain an average of an 85-degree temperature even after they're no longer actively receiving mental health treatment. I'm here to tell you that an elite provider can give you the knowledge, tools, and customized treatment plan that can cause the sun to come out, the snow will melt, the trees and grass will grow green for you, and you can enjoy yourself again. Many patients are relieved when they realize that their situation is not hopeless. They just needed to find an elite provider with the expertise to handle their care. Now, I need to be clear. The non-elite providers are good people that help a lot of patients. Their work is sufficient for patients that only fall to between 30 and 60 degrees before they seek mental health care. So don't think that I'm talking badly about other providers. Instead, I'm only explaining why a provider might have done good work even if you didn't see the improvements you were hoping for. This will help you to realize that you're not a hopeless case. You just might need a provider with more expertise. I hope this helps you to see that your continued struggles after receiving care doesn't necessarily mean that your case is too severe to heal or that your previous provider's care was bad. Instead, you just might need an elite provider. When you pair that with your willingness to engage, change, and work hard, you really can become your best self. Now be well.